Thank you. So as Beatrix has said, I'm here to talk about how we involved patients and the public within the Mobilise Consortium. And I guess it's really important to say that from the outset, it wasn't a question of whether we were going to do this or not. We knew from the get-go that this was an absolutely critical part of our research study. There is simply no point in us developing new and novel ways of measuring real-world walking unless we have the lived experience of people with long-term conditions as research partners beside us. We knew that we needed to do this to make sure that the work that we were doing was relevant and meaningful, and as has been said already today, that we were measuring something that we should, not just something that we could. So the question really wasn't why, but the question was, well, how were we going to do this? And that was really because, as we've already seen today, Mobilise is an exceptionally complex study. Not only do we have 4 patient cohorts, each with their own specific healthcare needs and manifestations, but we have multiple project objectives, 17 international sites, 12 different languages, 34 research partners, and a global pandemic in the mix. So we really had a little bit of a puzzle on our hands as to how we were going to do this in a way that wasn't simply just tick the box, but that was meaningful. And when we went looking around to see what other people had done, any kind of examples of good quality PPI were first of all few and far between, but also they were only answering one of those questions. They maybe had one patient cohort across one country with one research objective. So we realized pretty quickly that if we were going to do this properly, we needed to rip up the rule book and start again as to what meaningful PPIE would be for us. So we actually have developed a set of recommendations, and the poster for this is linked here. But essentially, we started with the core idea that the patient voice must be integrated and must be equal in every stage of our research process. And so in order to do this, we completely changed our structures to make sure that we had developed 2 different groups whose job was to make sure that PPIE was embedded in all aspects of what we were doing. So we had a patient and public advisory board and a patient and public PPIE board, and the 2 of them worked together in a kind of an feedback loop continuously to make sure that the patient voice was in all aspects. So the PPIE board provided oversight and made sure that the action plan that we were developing was being implemented, while our advisory group was primarily made up of patients who, again, were making sure that they were co-producing and co-designing these tasks alongside of us. So what this provided us with, I suppose, was a really stable foundation to make sure that we had that governance structure in place. But as we developed on through the consortium and through the project, what we realized is that we really needed to be flexible with this. So we have patients who are advising us across different time zones and obviously have fluctuating health conditions. So we needed to make sure that we were creating an environment that was safe and inclusive and accessible for them to be able to engage with us if and when and as required in the best way possible for them. So here are our patient advisors. I'm delighted that some of them are actually able to be here with us face to face today. It's nice to be able to see them in person rather than just on a Zoom screen. And all of them have obviously contributed significantly to this project, but while I have the opportunity, I would like to note specifically one of our patient advisors. Sadly, Isabel Sarajeeva passed away a number of weeks ago. She was not only an active member of our patient advisory group, but she was significantly involved in the European Lung Foundation for a number of years. So her contribution to the research space has been exceptionally significant, and I just wanted to specifically acknowledge her contribution. So with our patient advisory group, we needed to make sure that they were as representative as possible. So they represent people across multiple nationalities and with various different health conditions and with different experience of the research space. Together with them, we co-created roles, expectations, and terms of reference that made sure that they were comfortable in terms of what was expected of them, but also in how they would interact with us. And because of those structures, what we were able to do with them was to create outputs and tasks that really ticked each of the boxes in terms of the different PPIE domains from the NIHR guidance. So for example, in terms of dissemination, they have been absolutely integral in spreading the important message of Mobilise-D, which is that walking is absolutely integral to everything that they do. They highlighted to us that it is something that is really important to their sense of self, but also it's something that they feel is not discussed often enough with their clinicians. So because of that, they felt it was really important that we just didn't share this in terms of publications, but we went above and beyond that. So together with them, they helped co-design 2 webinars to talk about the importance of PPI, but also the importance of walking as a meaningful aspect of health. And they've also helped us co-design a video on the importance of walking, and they're currently co-designing 2 additional videos alongside of us, just to make sure that we promote the work outside of just scientific publications. They've also helped us to share the information back to participants in a way that is inclusive and acceptable to them. From an involvement perspective then, as I've already said, they have been equal co-researchers alongside of us at every step in the way, making sure that we are answering the questions that are important to them. So you've seen this picture of the conceptual framework a number of times today, and that's because it is a really seminal piece that highlights exactly why we are doing this. And our patient advisors helped to emphasize the really important bits of how we were interpreting that conceptual framework, emphasizing the importance of context, the emotional and the social elements of walking that are all impacted by changes to their walking experience. So they co-authored that publication with us. They co-authored the publication about the recommendations regarding PPIE, but also critically, they've helped us to co-design some of the questionnaires within the project. So our minimal important difference questionnaire went through them in terms of feedback, but also the experience questionnaire for all the participants within the CVS, and we have some insights for that on the next slide. But similarly then, they've also looked forward to the future. So we have a Delphi study that's ongoing at the moment where they're exploring with patients as experts how they want mobility data visualized to them over time so that we can look beyond just the realms of Mobilise-D and start to consider how we should do this in clinical practice, because all of them have said that this is absolutely critical for the future. Finally then, we have actually done some funding applications for additional work in and around the kind of symptom mapping and developing that concept of interest element a little bit more. We have some funding with the Michael J. Fox Foundation on this, which is ongoing, and again, which have some posters outside, and there's actually similar work ongoing in MS, which is currently under review. So they have helped us to submit and design those applications. From a participation perspective then, that's experience questionnaire, we have some snapshots of what it looks like here for the people that were actually participating within the CVS. And what we can see instantly is that remote monitoring is a hugely acceptable form of taking data from patients. They are all interested and willing to do this. While there's some work that needs to be done in terms of the form factor a little bit more, what's really interesting is that nearly half of our participants are saying, I don't want to be a passive participant. I want real-time data that tells me more about me and my condition, and that will help me engage with my healthcare professional in time. So this is a really important message for us going forward. So collectively, if we look at what our patient advisors have helped provide to us and what they've given to the consortium, they have really pushed us to develop novel and engaging approaches to inform the public about the importance of this work and the key messages around it. They've also improved our study design and have helped us to push the boundaries not only of Mobilise-D, but as I said, in the future with that Delphi study is a really nice example of how they've done that. But most critically, they've helped provide us with a really clearer understanding as to the importance of mobility. We have no doubt that real-world walking is a meaningful aspect of health. And because of that certainty, we can now start to delve a little bit deeper to understand which exact elements and which DMOs map to those lived experiences, because we now have this framework that other researchers can go forward with in the future. So what we've done with our patient advisors is effectively show that it doesn't matter how complex your study is, good PPIE is possible and it's integral to the success of any sort of project that you're doing. What we've done with our patient advisors is develop a roadmap for others to follow in terms of how this should be done in a meaningful manner. Our patient advisors have really challenged us with some of the key concepts of Mobilise throughout the last number of years. And because of that, they have absolutely strengthened each of the outputs that we have. If we consider all of the aspects combined, we now know for certainty that not only is real-world mobility a meaningful aspect of health, but that remote monitoring is an acceptable tool for patients and that they are dying for more information about themselves as individuals, but also in comparison to other people, so that they can use that as a tool to discuss their condition with their healthcare professional in the future. This is something that they want in their clinical practice, and they're asking us to help deliver it. Even this morning in the hotel lobby, some of our patient advisors actually said that as far as they're concerned, they see Mobilise simply as a first step. They have a lot more questions that need answering, and they're willing to help us do it. So I'd like to thank them all for their enormous contribution, and I'd like to invite Tova now to speak about her perspective of what it's been like to be part of Mobilise. Thank you.